Hi, my name is Jeong. This presentation was recorded on July 16th, and I'm going to be presenting on point-of-care testing. A little bit about me. I'm a rising junior at Gunn High School in California, and some activities that I participate in are speech and debate, science bowl, and baseball. In the future, I'm planning to go into biochemistry or bioengineering. So a little introduction to point-of-care testing. The pandemic has shown us the importance of having fast, reliable testing because it lets us reduce the number of transmissions per person by allowing them to be diagnosed more quickly. And the form of point-of-care testing that you all are most familiar with is probably rapid testing, or the tests that you can conduct at home to test whether or not you have COVID. And these are, in essence, what point-of-care testing or POCTs are. They are tests that can be conducted at or near the site of patient care. So that could be in the doctor's office or at your house. And they have to return results within 30 minutes. So for COVID tests, those are generally within around 15 minutes, which puts them under the category of point-of-care testing. Now, why is this important? Well, not only with COVID, but also in 2019, the two leading causes of death were various cardiovascular diseases and cancer. The thing about both of these diseases is that they can be treated more easily and more effectively when they are diagnosed more quickly, which is where point-of-care testing can be important because they can help make the testing process both easier and have more results more quickly so that patients can be treated as quickly as possible. So some key parts of a test are speed, cost, accuracy, and outcomes, which are the four topics that I will be covering in this presentation. So first, with speed, there is a chart you can see here of what could potentially happen with a symptomatic patient. And there's two different routes with testing that could be taken. The first is traditional molecular diagnostics. So for example, the PCR tests that most people take when they think of a COVID test. So these, especially at the beginning of the pandemic, they weren't readily available, and there were usually days to weeks of processing, which meant that patients would be out and about without knowing whether or not they had a positive test. This meant that in the case of a positive test, there would be significant stealth transmission, which was responsible for the majority of COVID cases at the beginning of the pandemic. Or if there was a negative test, that would mean that you wasted a lot of time and resources on a patient that ultimately didn't actually have the virus. And other people who did have the virus could potentially not have been tested as a result of that. On the other hand, point-of-care testing is a lot more readily available. And if there's a positive test, that means that the patient can be quickly isolated before they can come into contact with more people. If there's a negative test, then it doesn't use up as much time and resources, and they can always get a more definitive test result via molecular diagnostics if they believe that the result may be faulty, which I'll cover later in this presentation. The second topic is cost. Cost for point-of-care testing can be variable across the board, as you can see in the chart on the right. However, the main point is that costs for per test are significantly cheaper than a traditional laboratory test. This is because there isn't as much transportation costs, not as many production costs, and not as many doctor-to-patient costs involved in the process of point-of-care testing. So why doesn't this make point-of-care testing automatically the cheapest option? Well, this is because there's a lot of setup costs involved with point-of-care testing. What I mean by this is that sometimes when point-of-care tests are used in doctor's offices or in areas such as Africa that require tests for diseases that may be new, a lot of doctors will require new training for point-of-care testing as opposed to laboratory training. Second, there's shipment, because with new point-of-care testing, there's going to have to be new supply chains that need to be created so that the tests actually get to doctors and to consumers. And finally, there are the resources required to develop that test and distribute it more widely, which factor into the cost. However, over time, studies have found that this cost is spread out by the low cost of the tests themselves, not accounting for other variables, and it ultimately ends up being cheaper. Third, there's accuracy. When properly regulated and when the tests are properly carried out, accuracy is generally on par with laboratory testing. So for COVID-19, there was an 81% sensitivity compared to PCR testing for the Binax Now COVID-19 rapid testing kit, as opposed to a PCR test made by that same company. A potential pitfall is that some rapid tests and point-of-care tests may have a shorter detection range as a result of using a different, more portable assay for the test. So you can see in the chart on the left that while the rapid test was able to detect the virus at maximum viral load and for a limited amount of time around that, there was a small amount of time before it could be detected, before the pre-infectious positive and post-infectious positive that could only be detected by PCR tests. However, that was a relatively small case, small number of scenarios, and the rapid test still detected most infectious cases. Now, the chart on the left also shows you that there may be more false negatives, which means that a patient might have the virus and the test does not detect it. However, this was a relatively small sample, and patients can always check a potential false negative with a PCR test. Finally, there were actual patient outcomes and satisfaction. Overall, there's generally less time spent in a hospital or waiting for a doctor when patients are able to conduct tests at home instead of having to go to a doctor's office or a testing center, which not only improves patients' comfort and satisfaction, but also makes the whole process faster. Second, point-of-care testing and rapid tests are a lot easier for patients to use and remember because they can do it by themselves and instructions are generally easy. For example, with COVID testing, it's pretty straightforward to just take a swab and collect a sample from your nose, which is pretty much the same process that a doctor would follow with a PCR test, except that you can do it at home and get the results faster. This has other impacts as well, since it encourages the use of tests for other diseases that may come up in the future, because people will be more used to it and will find it a lot easier. So in conclusion, point-of-care testing can deliver valuable speed benefits for preventing diseases. They're low cost and highly accurate, and with good management and supply chains, point-of-care testing can be a valuable component of preventive medicine and disease spread prevention. These are some of my references. And I would like to thank my mentor, Dr. Jeong Cho, for helping me with my research on point-of-care testing. And I would also like to thank Ms. Rachel Casey and the Palo Alto Unified School District Advanced Authentic Research Program for their help as well. Lastly, I would like to thank all of you, the audience, for listening to this presentation today. And if you have any questions, you can contact me at my email on the right. Thank you for listening.